Hello, this is Tori Flynn, clinical exercise physiologist with Ohio Health Cardiac Rehabilitation. In this presentation, we will discuss some exercise basics and recommendations, as well as some special considerations for the cardiac population. Being inactive is a large risk factor for coronary artery disease, and more than 60% of Americans do not meet minimal levels of recommended physical activity. Regular exercise can improve endurance and strength, improve metabolism, improve resting blood pressure, improve cholesterol, improve mental functioning, help with weight loss, decrease stress and anxiety, and improve blood sugar control. When exercising, you should always complete a 5 to 10 minute warm-up. This will slowly increase heart rate and blood pressure, prepare your body for aerobic exercise, and help prevent injury. The goal for aerobic exercise is to work your way up to 30 to 60 minutes, 4 to 6 days per week, 150 minutes a week total. This can be broken up to as little as 10 minutes at a time, and this is when your heart is getting the most benefit. You will then want to do a 5 to 10 minute cool down to slowly decrease heart rate and blood pressure. This can also reduce muscle soreness and decrease symptoms such as dizziness or lightheadedness. Resistance training can consist of therabands, free weights, machines, or body weight exercises. We recommend 2 to 3 days a week, completing 8 to 10 exercises. To measure intensity of exercise, there are a few things we can look at. In cardiac rehab, we will be monitoring your heart rate, and you can measure this at home by doing a pulse check. You will be given a target heart rate range that is specific to you. You want to avoid going higher than the upper limit of your target. Higher heart rate does not equal more benefit. RPE stands for rate of perceived exertion. This scale is solely based on how the exercise feels to you overall, related to your muscles, breathing, any pain or fatigue you may feel. The scale goes from 6, which should feel like you're sitting in a chair and resting, to 20, which would be the hardest thing you've ever done. Our goal is for you to stay in between 11 and 14 during aerobic and strength training. Metabolic equivalent, or a MET, is a unit of exercise that shows how much oxygen our body is using to produce the energy it needs. 1 MET is the energy required to sit quietly in a chair. A 5 MET activity will require 5 times the amount of energy needed at rest. During exercise, it's important to pay attention to how you're feeling. If you experience any of these symptoms, stop exercising right away and rest. Make sure to tell a staff member if you are in cardiac rehab, or let your doctor know if any of these happen when you are at home exercising. When exercising outside, temperature can affect the body's response to exercise. It is not recommended to do vigorous exercise in temperatures hotter than 80 degrees or colder than 32 degrees. Both of these extremes can put extra stress on the cardiovascular system. If you occasionally experience chest pain, a 10-minute warm-up may help lower your chance of feeling angina. If you do get chest pain, stop exercising immediately and sit for 5 minutes. If the pain does not go away within this amount of time, follow instructions for taking your nitroglycerin. Exercise can have major effects on blood sugar, so if you are a diabetic, it is important to check blood sugar before and after exercise sessions. Do not exercise on an empty stomach and always bring a snack with you. Make sure to be aware of symptoms associated with high and low blood sugars. These include lightheadedness, excessive sweating, fatigue, or vision changes. If you suffer from diabetic complications such as retinopathy or neuropathy, it is important to also monitor blood pressure and perform foot checks regularly. Tobacco use should be avoided at least 2 hours before and after exercise, as it has immediate effects on the cardiovascular system, including increase in heart rate and constriction of blood vessels that can cause unnecessary strain.